5 reasons why moms should not have pelvic floor surgery for their leaking or their prolapse. Let's talk about it. All right. Reason number 1. But before I get to reason number 1, let me just say this disclaimer. I am in no way talking against or being anti-surgery. Surgery for your core or pelvic floor is a valid medical procedure that many women both need and benefit from. So that's not at all what this video is about. What we're talking about, though, are the reasons why surgery isn't the best option for the many other women who were being told that it's the only option for us. All right, let's get into that. Number 1, it costs. It is expensive. Now, I know the cost of something is not and should not be the only reason for you to consider or not consider getting it. But when we're talking about cutting into our bodies and having surgery and repairs done on an area that's already in dysfunction, that's already causing issues, that is a lot of money to pay, right? And a pelvic floor surgery, depending on the extent of the damage and what all is done, can run you upwards of $10,000, $20,000. So that's the number 1 reason why not only is it not appropriate for some women it simply is out of reach financially. That surgery, it costs a lot. Reason number 2 why pelvic floor surgery might not be the best answer for you. You might not even need it, mama. And this is where being empowered with the right information and the right understanding is really going to help you. Many women, like myself, we're being told that the only option is surgery, and that simply isn't true. For many women, the issues that we're dealing with our core, with our pelvic floor, can actually see tremendous improvement and progress with more conservative approaches, like lifestyle change, like changes in our nutrition, like exercise, like core and pelvic floor rehab. So the second reason is you just might not need it, okay? Reason number 3 for why you should not get, or maybe really consider getting pelvic floor surgery is a high percentage of women. Not sure exactly, but I'll put it in the video by the time it uploads. Many women, they get the surgery and they're still having the issues, meaning the problem that you go into the operating room with is not even completely resolved with the surgery. If I'm gonna get a surgery like that, and mama, doesn't matter what you've been told, this is a big deal. Maybe it's common for women to have pelvic floor surgery. Maybe it's a surgery that's done often. That doesn't mean it should be taken lightly. It is a big deal. If I am going to have someone cut into and work on my body on an area that's already in dysfunction or leaking or pain, I want to know that the procedure is going to work. And there is a high percentage, something like over 50% of women still have the issues that they got the surgery for. All right. Reason number, are we on 3 or 4? I don't know. I have to edit. I think we're on reason number 3. No, 4. For why you should not have surgery for your pelvic floor. Did you know that having pelvic floor surgery puts you at a higher risk for pelvic floor dysfunction? All right, let me say that again. The very reason that you're going to have the pelvic floor surgery, the surgery itself puts you at a higher risk for leaking and prolapse later on down the road. I don't know about you, but to me, that is something I would want to be aware of and that I would greatly consider if I'm deciding on whether or not I'm going to have surgery. What are the risks, right? What could happen to me later on? Because mamas, our core and pelvic floor, our strength, our healing, it's not just about today. It is about long term, having a healthy and well-functioning body for life. All right? If you, right now, are liking this information and you're finding value from it, please download the guide in the description. The 7 mistakes that's keeping your core and pelvic floor from healing and what you must do instead. I created this guide, this mini training, especially for you, mama, if you're leaking, having symptoms of prolapse, or trying to strengthen your core so that you can get started on the right path. All right, download in the description, and let's get back to our countdown. Reason number 5 for why pelvic floor surgery might not be for you. Oftentimes after pelvic floor surgery, you'll notice other problems that come up. Now, of course, there is no absolute way to say that this issue that now came after your surgery was a direct result of the surgery. We can't know that. Nobody can. But, mama, I will tell you this. I have talked to, I have trained with, I have studied with hundreds and hundreds of women, and I have heard it time and time again. I went in for surgery, and then after my surgery, after my recovery time, A, B, C, D, E, F, all the way to Z is now wrong. What's up with that? Many, many times the pelvic floor surgery can be related to, right? Correlated with other issues that come up. Now, to be fair, sometimes the issue that you had the surgery for, the surgery sort of just uncovers a sort of weakness or dysfunction that was already there. Okay, I accept that. But that's not the case for every woman. Sometimes the surgery itself can cause other issues of pain, of dysfunction down the road. That's definitely something to consider. And let me just leave you with this little bonus, right? So many women have found tremendous improvement, have found strength, have really, really transformed their cores and pelvic floors when they were told the only thing they could do is surgery. Many women have found transformation in the proper core and pelvic floor healing and rehab and recovery programs. So if you are considering surgery, if you've already gotten surgery and maybe you're seeing some of the things that I've said pop up, try an alternative approach. Try a holistic approach. And even if you do opt for surgeries, mamas, because like I said in the beginning, surgery is a wonderful thing that many women will benefit from. The issue I have is that we're all being told that it's the only option, and that's just not true. But if you're going to have the surgery, or you already have had the surgery, mama, please know this. It cannot take the place of proper training and rehab and recovery so that you know how to use your body in the right way so that that surgery can be a success. I have heard from many women who got pelvic floor surgery and it helped them tremendously. But that surgery didn't fix the underlying issues with their posture. That surgery didn't fix the underlying issues with their breathing system, which is directly connected to the core and pelvic floor. The surgery didn't change their movement patterns or teach them how to manage pressure, all of which can contribute to pelvic floor and core dysfunction. Even if surgery is on your path, right? Because this is about holistic healing. And for some of us, we need that surgery. And there's absolutely nothing wrong with that. But remember, surgery is part of your healing. It's part of your journey, right? It's part of the whole program. Make sure you get the recovery, the rehab, and the reconnecting that your body needs so that you can have the best results from that surgery, right? All right, so go ahead now, since you watched this video, and click on the next video where I'm going to be breaking down one of the #1 reasons why Kegels are making everything worse. If you're a mama and you've been doing Kegels and you want to know one of the #1 reasons why you're still having issues or your issues are worse, watch this next video.